The main advantage, in my opinion, is to have one instrument allowing us to take all required measurements for IOL power calculation, and not only IOL power calculation. When I have the Pentacam AXL, I can take advantage for keratoconus diagnosis and screening. I can take advantage to follow up patients with corneal opacities thanks to the corneal densitometry, which is not featured by any other device. I can look at the regularity of the corneal surface. I'm used to look at total corneal astigmatism. I like to look at the nuclear density of the cataract, which has a relevant role from many points of view. So if I want to do all these kind of measurements, the only way is to have the Pentacam. And then if I want to make IOL power calculation, if I have the Pentacam AXL, it just takes a few seconds more and I can measure the axial length, and I have the availability of all modern formulas. I can do ray tracing if I want. So just one instrument and so many features that devices, optical biometers with no Scheimpflug cameras cannot do. And also Scheimpflug optical biometers with OCT, but not with so many points analyzed by the Pentacam Scheimpflug camera, will never provide so much information like a rotating Scheimpflug camera combined with a partial coherence interferometry can do. Well, the main advantage is the possibility to take a closer look at total corneal astigmatism. This is very important for both monofocal and even more multifocal IOLs, because in our practice, about 70% of multifocal IOLs are toric. We aim to correct the minimal astigmatism always. So when we implant multifocal IOLs, we need to correct all astigmatism. We cannot leave a residual of 0.75 because patients with multifocal IOLs do not accept it. So in order to be as accurate as possible, it's mandatory to have a look at the total corneal astigmatism. Whether this is measured, like I prefer to do with my calculator, which is available on the Pentacam, or whether you use the Barrett calculator, which estimates posterior corneal astigmatism. In any case, you get very good outcomes, and you can have a more realistic picture of the corneal astigmatism. So this is, in my opinion, the main advantage. Then you can take also advantages from the possibility to measure the pupil decentration with the cord mu. You have the cataract summary display, which gives a lot of information about aberrometry of the cornea. So if the spherical aberration or other aberrations are too high, you get an advice from the machine that it might be not so wise to use a multifocal IOL. So a lot of information in just a few seconds. I was excited. When I saw this just this morning, I couldn't believe my eyes, because I've been discussing with many companies for many years that our desire was to have a device able to analyze separately the aberrations and the visual quality from the cornea and from the intraocular lens. Okay, there are some aberrometers able to measure the anterior corneal surface aberration, and then by subtracting these aberrations from the total eye aberrations, they were able to measure, to calculate, not measure the internal, but there was always the posterior cornea inside together with the internal aberrations. Now we have the first instrument that with one click can measure and separately analyze the corneal, anterior and posterior surface, and internal aberrations. This, I think, can be a great advantage, especially when we analyze the outcomes of multifocal IOLs with problematic patients complaining about halos and other visual disturbances.